professionals in Nigeria have appealed to both the federal and state governments to prioritize free and compulsory girl-child education in rural areas to reduce the rates of female genital mutilation in the country. With the theme, Her Voice, Her Future, investing in survivors-led movement to end female genital mutilation, the expert pointed out that these will enable the girl child have early and proper understanding of the dangers of the practice. Mary Onyemachi completes the report.
The practice of female genital mutilation dates back to ancient Egypt, where women are known to have circumcised the girl child to preserve their virginity. Statistics from the World Health Organization show that more than 200 million girls and women have undergone female genital mutilation, FGM, in 30 countries in Africa, the Middle East, and Asia, where FGM is practiced. Female genital mutilation, FGM, also known as female genital circumcision, is a traditional harmful practice that involves the partial or total removal of external female genitalia or other injury to female genital organs for non-medical reasons. FGM is often done with crude and unsterilized objects such as knife, razor, or broken glass, which has health implications to the victims, such as infection. The gynecologist Anietie Mfon Akman says poverty and ignorance are the main factors that drive the prevalence of this harmful practice.
Inhumanity to women. It's women that practice, it's not a man. So there is no benefit. As I said, it's not for medical reason. If there is a reason, for example, a woman have cancer of the vulva, you understand? We will remove, that is, we remove a woman have cancer of the vulva. You will not call that one female genital cut, we give a name for vulvectomy. Do you understand what I'm saying now? But if a young girl just normally everything is somebody carrying knife, say want to cut, that is cutting. But as I said, be careful, don't go and tell somebody is doing female genital mutilation. If person may even born, you can burn your vehicle.
A midwife in Uyo, Queen Asuko, noted that FGM has no known health benefits and can lead to immediate health risk, as well as variety of long-term complications affecting women's physical, mental, and sexual health.
The dangers are enormous. Number one is bleeding, because now these people doing these things, they are just doing it out of, I don't know how they are doing it. Yes, culture. Now they are using unsterile instruments like razor blade and knives, then all these sharp objects like broken bottles. Then all these things can lead to the woman bleeding.
Human rights advocate Winifred Ikara called for the inclusion of FGM as a standalone subject in schools to ensure school children have knowledge of the dangers of this practice, urged members of the society to create an enabling environment for victims and survivors of FGM, devoid of stigmatization.
It should be like an FGM safeguarding education. Let this be introduced in schools. The way we have puberty introduced in schools, the way we have adolescents introduced in schools, the way they talk about sex education, the way we have menstruation introduced in the curriculum. I think even if it is like a sub-heading or an heading, let there be female genital mutilations where they can teach these children what it is, the dangers of female genital mutilations, everything that has to do with FGM.
It is important that everyone, including the NGOs, religious organizations, and media outlets, lend their voices to put an end to female genital mutilation. Mary Onyemachi, ADBN TV.